right, we're going to move on to the next presentation by Dr. Catherine Porter and Dr. Catherine Collin. They have a Padlet as well. I will put that in the chat right now. There you go. I will just hand over to you to take us off.
Perfect. Morning, everyone. I'm Catherine P. And we've got Catherine C. Catherine, you're on mute.
Yeah, I'm Catherine C.
So we're gonna co-present this session, which we co-created with our students. And I'm just gonna hand over to Catherine. Let me just get you, where's the control the screen thing gone? Hang on.
I'm happy for you to just move the slides across. No, that's easier.
I had it a second ago. I've got it now. More. Host tools. This worked a second ago. We literally checked the remote control. There we go. Catherine, you should now have control of my screen. And if I put this in presenter mode, I don't know what I've done. There we go. Let me just go. Can you control it?
There we go.
There we go. Oh.
Slightly scrambled the slide, but never mind. Okay. So good morning, everybody. So in this presentation, we're going to take you through a co-creation journey. And this was really around developing a TBL session, which was in collaboration with the students. And this one was on. So let me just try and get across to the next slide. Oops. Hang on. Being a little bit too impatient with it. So that's the Padlet link, which is in the chat. It's not moving back for me.
It's saying that you're not controlling my screen, Catherine. Oh, you are now. Oh, but you're scribbling all over it. Shall I control it?
Yeah, that might be easier. Yeah,
right,
okay.
Let me just stop that. Let me just reshare.
Apologies, everybody.
We did try all this before.
Zoom sometimes has a mind of its own.
Yeah, so we should be. Can you all see our co-creation journey? Perfect.
Okay, that's great. So what happens here is this journey really evolved from a 2-week pause from the TBL sessions by the students. And the reason for this pause really was to give the students some space to reflect and to go back and revisit some of the past cases. But we actually decided to use this as an opportunity to structure the students' revision. So what we did is we gave each of the teams a previous case that they'd studied, and we asked them to come up and identify a topic that they found really tricky, and then come up as a group with an application exercise that would actually address that issue, and it could consolidate learning for the whole group. So we gave them a Padlet to work on, and they
I don't know what's going on. Right, there we go.
Okay.
Yeah.
So when we actually started to look at the Padlets that the students had created, I was absolutely blown away by their engagement. There was real creativity on the Padlets, and they were really bursting with creative ideas. So from this, we realised that this wasn't just an effective independent team building exercise and a revision strategy, but it actually provided us with some real insights into the students' TBL preferences. And also a lot of ideas that we could actually develop as an academic team to develop and actually put on some of these TBL sessions. Led us to basically taking one of the group's ideas and developing it. And that's what we're going to talk about today. We're going to take you through this first part of the journey. Okay, so yeah, next slide, please.
There we go.
Okay, so first of all, I'm just going to tell you a little bit about the programme. So in September 2024, we launched a new type of optometry programme at Manchester. And this was really heavily focused on clinical experience and team-based learning, right from the start of the course, so right from the very beginning of first year. Now, there's really strong support for the use of TBL in healthcare because it promotes collaboration and application of knowledge to solve problems. And importantly, it integrates the different topics as well. And it allows students to move from the knows to the shows how at a really early stage of their training. Now, teamwork and problem solving are really core skills for optometrists. And optometry in the UK is now moved to be a registrable degree. So it's really important that we that we focus on developing student readiness for practice. Now, when we're actually creating the TBL sessions, as I'm sure a lot of you know who are involved in TBL, it can be really challenging, and it really requires us to identify and integrate tricky topics and design exercises to understand some of these misunderstandings. So, yeah, next slide. So we're on to the Padlet. So we're just going to really take a pause and for you to just think about a topic from your own area, from your own experience that you find students really find tricky with. And just write them on the Padlet. And then what we're going to do is, as we're going to go through the rest of the slides, and we'll talk you through how we develop this, you can maybe think about how co-creation could be used to address your tricky topic. So I don't know if we got the Padlet, unless we come back to that.
Bring it up now. Let's have a go. Here's my Padlet.
Yeah, so we probably all got areas where students every year will struggle with, and we really try and create different exercises, you know, to really try and address this. And I'm sure we've all got different ideas. Interdisciplinarity, yes, definitely. Critical analysis we've got there, yeah. So it's just thinking about, this is a really problematic topic, and this comes up every year.
Yeah, not using jargon when explaining medical terms to patients, that is definitely something our students struggle with, isn't it, Catherine?
Yeah, absolutely. Anatomy, physiology, yeah.
Brilliant.
There's so much anatomy, and it's trying to put that, embedding that clinical relevance in there as well. Yeah. But what we were doing here is, rather than us identify a tricky topic, we wanted the students to go back and actually find something tricky and then create an application exercise around that. Yeah.
So,
yeah.
oh, this is really good.
Yeah.
What I'll do, I'll stop sharing this, and then
so if you're working on that Padlet, any ideas that come to mind, we're going to come back to that Padlet a little bit later on.
Share. So if I bring this back up, ooh, here we go.
Okay, so TBL in optometry in Manchester, what does that look like? Well, what we do is the students work through lecture material online, and in addition to this, they attend some clinical sessions on campus as well. And then once every 2 weeks, we hold a full day TBL session, and this is for the whole year group in a large room. And we start with the traditional model of a series of IRATs, and then that's followed by the whole team working through as TRATs. And this allows us to identify areas that might need additional clarification. Now, following on from this, we use a series of application exercises, and this is really just to bring alive some of the concepts from the lecture notes and apply them to real problems. Now, this also allows us to integrate different topics because we've moved away from the kind of siloed units, and we're now combining topics such as anatomy, optics, and communication. Now, on this slide here, there's just some examples. Now, you might not recognise it, but on the left here, we've got an optic nerve. You can see it's blood supply, we've got pipe cleaners, and we've got straws as well to simulate the nerve fibres. In the centre, we've got a role play exercise, which you might remember if you've had your eyes tested for better position 1, position 2. And on the right there, we've got a team that's building a brain, and that was within a game of Pass the Parcel, with each layer having a piece of brain, and they're having to construct the brain on the paper there and put as much information as they can around the different parts. So that's kind of what it looks like, a typical TBL session. Yeah, so next slide, please. Yeah, so the driving factor really in introducing this create your own, excuse me, TBL exercise was initially to encourage revision. But as I say, we quickly realised that the reach of this was much, much greater. So the TBL sessions tend to be quite structured and quite facilitated. But here we had an opportunity for the student groups to be independent and autonomous. Now, this required them to display real teamwork, leadership, and time management skills. Now, when we're designing the TBL sessions, it really requires a really high level of subject expertise. And this is what made the exercise a really powerful strategy to reinforce and consolidate and apply the learning. So essentially, it's harnessing the idea that the best way to learn a topic is to teach it. And it also gave us some real insight to the alternative approaches of TBL design, but this from the student's perspective. So the exercise required the students to brainstorm ideas using a Padlet, design the session using a lesson plan. We wanted it to include a debrief, a timeline, and resources that were needed to run the session. Now, students were also required to, it's okay, you can go on to that next slide, yeah. They were also required to reflect on it as well. Okay. So this approach has got strong pedagogic alignment, and I've just listed some examples on here. So we've got active learning, because the students had to really engage with the content, and they had to go back and revisit previous lectures, and they had to collaborate to create this original application exercise. They were also using peer teaching and collaborative learning strategies, because they were learning from each other. Each one of them had a different level of understanding and a different perspective, and they could help each other in the groups as well. And it also reinforced their knowledge through group discussion and teamwork. Next, we've got authentic assessments. And rather than the students applying their knowledge to a problem in a traditional TBL setting, here we were asking them to actually apply their knowledge of the topic to create the session itself. Finally, we've got constructivism, because they were building on and reconstructing their knowledge based on personal challenges within the topics in optometry. So I've got an example of the Padlet on the next slide. Okay. So this is the team that actually, the Padlet that went on to become the TBL exercise that we're going to talk about. So when I began to review the Padlets, as I say, I was absolutely astounded by the engagement on these Padlets, particularly because this was a formative exercise. All 14 groups of students really strongly engaged with it, and they came up with some really fantastic and creative ideas. And this included model making, bingo, we had snakes and ladders, quizzes, lots of other sorts of games. They really seem to like games in TBL. And many of them actually combined different elements. So we had quizzes and games combined with model making as well. So in this slide, you can see part of the Padlet that if, oh, sorry, I think it's on, yeah.
It just keeps jumping automatically. Sorry, I don't know why.
Yeah.
Weird.
Okay.
Sorry, go on.
So, yeah, so this group not only designed the TBL session, which included a quiz, but they actually designed a model to be built in the TBL session. But rather than just saying, oh, we'll build a model of the eye in the orbit, they actually went and made it out of paper and cardboard and uploaded a picture. So you can see the picture here that they uploaded. So you can really see how well the students were engaging. Yeah, so I'll just go to the next slide. Okay,
There we go.
So in the student reflections on the Padlet, there's quite a lot of text on the slide, but I've just highlighted the main points here. This is really just some feedback from the group, and this was really echoed across all of the groups. So we've got here, working as a group helped us develop our interactive activity. It was highly collaborative and enriching. And we've got, it showed us active recall and group discussion, an idea most of us were not used to, and was incredibly effective for recalling information. And we've got overall, we believe this project really helped us remember the common features of the ocular nexa. So one of the things to sort of to remember is these students were just coming out from A-level, so they're not used to kind of revising in a different way. Sorry, if you just go back to the...
Sorry.
Yeah, okay. Okay, so I think this was really important as well. Going forward, we think many of us will take a similar approach to tackling concepts we may find hard, whether that be through matching activities or group study sessions. So it really kind of opened up to the students alternative ways of revising and actually revising as a group as well. Yeah, okay, so let's go to the next one. So following on from this, the adjusted and anonymous feedback form. So we know, obviously, when it's anonymous, the feedback may be slightly different than when we actually know what the students are writing in their reflections. And this actually found that the majority of students found that this exercise actually improved their team working skills. And this was interesting because the students were already experienced in team-based learning. They'd already had many structured TBL sessions and they were used to group learning. But what this exercise added was this element of autonomy. And this is really important when we're developing healthcare professionals. Okay, so I'm just going to come back to the Padlet. Okay, so this Padlet involved the creation of a model of the orbit. Now, binocular vision and how the 6 muscles move the eye is traditionally a tricky subject for students, and we know this from experience. So after seeing what the students had created here, I sent the Padlet to Catherine P, as this is her area of expertise, binocular vision, and this ultimately developed into the TBL session. So at this point, I'm going to pass over to Catherine to carry on the story.
Thank you very much. So when I received this, I looked at it and I was really excited. As Catherine's already said, our teaching at the university has always been very traditional. So we had our own unit and we taught our own, it's jumping even for me. We had our own unit, we taught our own years, and there was very little interaction. And I have never really taught the 1st and 2nd years other than having them as my tutees. And then this is really frustrating for me because when they get to me in final year, they've already developed this idea in their head that binocular vision is really difficult and they dislike it and they don't understand it. And they've really struggled to try and make the link between the theoretical kind of anatomy physiology aspect and what we do in the clinic with patients. So when Catherine sent me this, I saw an opportunity that had never been available to me before. And I asked if I could have a go at designing a TBL exercise, because again, I'm not really involved with the 1st and 2nd years other than to teach my topic from the grassroots up. So Catherine went, yeah, you can have 2 hours. And I thought, right, okay, let's see if I can actually make this work. So you can see here, and I'm going to come back to this in a second, they've got the first model and they've done a really good job, except that the eye is kind of all stuck down with sellotape and our eyes move freely in our globe. The muscles move freely over one another through quite a complex system. So I needed a bit of a proof of concept. And I wanted it as anatomically correct as possible. So in true Blue Peter style, I went to rummage about in my kind of cupboard of doom to where all the stuff that I don't throw away, like bits of ribbon from gift boxes and sellotape. And you can see I had a tennis ball and a bit of cling film. And this brown box was from like a delivery of bottles of juice that I'd had delivered. And it was like a giant egg box. And I thought, right, let's give it a go. But actually, this attempt was kind of unsuccessful because my tennis ball was too heavy. Sellotape doesn't stick to a tennis ball. The Hessian didn't work, and it didn't move freely over the cling film. It stuck. So I could definitely see the potential. So at that point, I went shopping. And I went to a craft store and I bought some gauze. I bought some polystyrene balls and some dressmaking ribbon. And I made up a model, which this is my go here, and I realized it would work. And then one of my colleagues, Ketan Parmer, I was just going to draw a black pupil in the center of this, but Ketan really went to town, and as you can see, he has beautifully decorated the eyeballs with all the blood vessels, and the irises are all different colours. He's even put some glitter on for the limbus. So what we did was I'd recorded the lectures. So they'd got extraocular muscles, eye movements. They were about 30 minutes each. The students had to watch those. And then in the TBL session, I just gave them these materials and I said, right, make me a model of the eye that works. And then we also had an eye muscle game. And with that, it was lots of questions on a computer, presented on a PowerPoint. And the questions were, which 2 muscles are used? And then it was to look, are you looking up and right? Are you looking down and left? Are you looking over to the right? and I'd given them googly eyes, and each of the eye muscles, each 6 of them, the right eye were all printed in blue and the left eye were printed in green. And it was basically a competition because we asked people, there was a prize for the most anatomically correct muscles, and then there was also a prize for the number of questions that they got right. And it's amazing what students will do for Tony's Chocolonely chocolates. So before the session started, I was interested in what their confidence was like. So I used Mentimeter, and I just asked 2 very simple questions. So how confident are you at knowing the actions of the extraocular muscles and then the innervation of the extraocular muscles? So you can see beforehand is the purple, and then at the end of the session, we asked the same questions again. And I was really delighted to see that their confidence increased, because as you all know, if students are confident about something, they are maybe not scared of the topic, they're not going to avoid it, they're not going to think it's difficult. And this really made me delighted. So then we asked them on the Mentimeter again for a word cloud, what 3 words would you use to describe the session? So lots of people have said that it was fun, informative, interesting. Some of them have said it's slightly confusing. And some of them have said it's slightly rushed. And obviously we will take that away. It was the first time we did it. We always reflect on our teaching anyway. So we will give them more time. We know how we can make it better next year. So they like the interactivity and they like the fact that it's fun and challenging. So then when Catherine was looking at the literature on co-creation of team-based learning, there's actually very little out there. So we thought we'd like to write a blog about our experience, get the students involved in this as well. So we interviewed Team 11, and they were unbelievably delighted that their idea had been taken and kind of driven forward. And they were really enthusiastic that this had been used. So one of my first question was, well, why did you pick the eye and the extraocular muscles? Because we know that students don't like that. And they said that actually visualizing the structure really helped them understand the anatomy, and making the model helped them understand how all the different parts interact and how they all fit together. They said that it really helped with their revision and to consolidate their knowledge. They really liked the interactive learning aspect, and they thought it was fun. A fun group activity when they were making the model together, and that made the learning more effective. And then one student believed that the co-creation of these teaching materials was beneficial because they know themselves what learning techniques help them. So some people like to chat with one another, others like to make flashcards. And so this really made the topic more engaging, which makes me really happy.
Sorry, Catherine, just quickly say we are at 20 minutes. We do still have a few minutes. But
Okay,
just be aware of time. Yeah.
last two slides.
Brilliant, thank you.
So these are some of the quotes that the students have given us. They like being involved. They like having the application exercise. And then my favourite thing that they said to me was that they realised how much time and effort we put into planning the TBL sessions. And I think that some students think that good teaching just happens. They maybe don't realise all the work that we put in the background to make the sessions engaging and fun for them. So that really was insightful for them. And then for me personally, this was a really fun thing to do. I love my topic anyway, but to be able to get involved with actual model making so early on in their careers was really rewarding. So I know that some people have posted some topics that they found difficult on the Padlet. So if I just go back to sharing that, maybe over the course of today, if you could think about, is there a way that we could make anatomy easier for first year undergraduate nursing students? Have you got any things that you've done? Catherine, certainly we can share our brain stuff with them. Has anybody done anything with learning outcomes and assessment rubrics? I think that getting students to write those themselves, and maybe we could use the Padlet sandbox that David talked about earlier. So if you could, over the course of today, suggest a co-creation exercise, we can come back and look at this in asynchronous time. And there we go. I've slightly run over. But if anybody's got any questions, fire away.
That was brilliant. Thank you so much. I'll immediately start with a question from the chat. Isabel is asking, are the students doing multiple modules using TBL? I wonder if this helps with engagement.
I'll hand that over to Catherine because we've seen.
So in the new, so traditionally, the course had several different units that ran in parallel with each other. So we would have ocular anatomy, we would have optics, we would have maths. It's all now been put into one module. So essentially there's one module which runs in semester 1, and there's one module that runs in semester 2. So all of the topics have now been integrated together. And this is why in the TBL sessions, it's really important that we try and integrate these topics to really prepare these students for the future, because patients don't come in with just an anatomy problem. They have, they might have headaches, they might have some problem with the eye, they might have a problem with their vision, problem with their spectacles. We need to integrate all these topics. So that's the kind of rationale behind it.
Thank you very much. We'll have time for one more question if anybody wants to put a question in the chat or ask them. I think Louise answered the whole questionnaire for you, or put in a whole question. She said, what did you do, in quotation marks, with the topics that other teams came up with?
Yeah, so I can answer
Catherine.
Yeah, so it's still very much a work in progress, because this is really quite recent. This only happened a few weeks ago. We only delivered this session just before Easter. There's several other ones on Padlet that we are looking to develop, and we're actually going to run those after Easter as well. Yeah, but it really gave us some insights into the ideas that the students actually found creative, and when we come to redevelop TBL exercises for next year, we're going to use some of the students' ideas as well. So it was really valuable to have the input from the students. Yeah. Has anybody else used co-creation to address a tricky topic? No.
I think a lot of people are leaving as well. A lot of people have appointments at 10.
Okay. But
So
yeah, we'll
wrap up.
leave the Padlet up, but it'd be really good for people to put some comments on there.
Yeah, that'd be lovely. The link to that Padlet is also on our festival Padlet, so if people want to add things later on, please do. Sorry, Catherine, did you want to say anything?
No, I think May has just asked, where can I learn more about TBL? If you send me an email, we could send you, and my email's on this slide, we can send you the stuff, because this time last year I knew nothing about TBL, and I wouldn't say I'm an expert, but we're definitely getting there. I can send you some stuff that we've been looking at. But thank you so much, everyone.
Would you please send me the email on the chat so I can?
Yeah, it's on the Padlet as well, but I'll put it in here. Catherine.porter@manchester.ac.uk. There we
Brilliant.
Go. Thank you.
Thank you. I'd like to again thank all the presenters, David Jarman, Catherine Collin, Catherine Porter. Thank you very much. And to everybody else, I just want to remind you there's a feedback form. It's on the Padlet. Please do fill it in if you have time. Also, I'd like to remind everybody of the mosh pit activities from the festival Padlets. There's a food tent and a walking tent. Please have a look at those. They're very fun. Thank you all very much, and see you at the 1 o'clock session.
See you soon. Bye.